if you have knee pain, there might be multiple factors that contribute to your knee pain, but one of the most common issues that I've seen in my practice is vastus lateralis tightness. So it's one of your quads, the lateral quads, gets very tight, sometimes develops trigger points from being tight for a very long time, and it causes patellar maltracking, pain into the knees, specifically when walking downstairs. That's a telltale sign of that. Two things I usually prescribe for this in terms of loosening up that muscle are foam rolling and couch stretch, so stretch for the quads. Foam rolling won't be as good as manual therapy is, but in the time between treatments, if you can do something daily to help alleviate tension in that muscle that's being affected, all the better. So for foam rolling, you get onto the vastus lateralis by first going straight on. Straight on will be rectus femoris, so just a slight lateral tilt to the side will get your vastus lateralis. Going too far to the side is too much. You don't want to be on your IT band. So just between straight on and slight tilt lateral will get onto your vastus lateralis. If you don't find any trigger points there, there's nothing painful in that whole muscle, then this might not be your problem causing knee pain. But if it is, if you feel that painful spot along the muscle, usually in the center of the muscle between the hip and the knee, then stay in that position, stay in that area for about a minute, between a minute or two, and just work that muscle slowly, sink into that painful spot. That's going to help mobilize and bring circulation to the area. Once you've warmed that muscle up, we're going to get into a couch stretch here to stretch out the quads. Start with a lunge position like this. Lean forward and get your foot on top of the couch. So anything about this height will do. This is a hip thrust attachment that I like to use. You can use a bench, a couch, anything about this height. If you're really tight in the quads, you might only be able to come up this far, and you'll feel that stretch into the quads. If you're more flexible, aim for getting straight up into this upright position and squeeze your glute in that trailing leg. That's going to intensify the stretch into your quads by driving your hip forward. You can also add the arm to this, so arm straight up. You can lean into different angles to find different angles of pull into your quads and hip flexors. If you're a beginner to this stretch, hold for about 20-30 seconds per set. You can relax out of it and then go into another set, and same thing, 20-30 second hold. As you get more practiced, you can hold these stretches for longer. It'll give you more lasting benefits in flexibility. So these couple things, this foam roller, trigger point, massage, and this couch stretch, I usually prescribe this daily, to do daily. Now, if you're not sure about what's going on in your knee and you feel knee pain, make sure you go see someone who is skilled in assessment, will be able to assess you thoroughly, make sure that that is specifically your problem, that vastus lateralis. It's not always the case. Although it's a very common problem that I've seen, it's not always the one issue impacting people's knees. Sometimes it's hamstrings, sometimes it's vastus medialis, it could be other elements, arthritis. Everybody's an individual and has an individual past in what caused their dysfunction, and that needs to be assessed and found out. So if you're not sure, make sure to get an assessment. But if you want to check out on your own and see if that vastus lateralis is a problem for you, you can try it on the foam roller, see if there's a painful spot in the center of your quads, work it out, give it a stretch. That'll help lengthen it, get some movement through that muscle, hopefully alleviate some of that tension into your knees. Another issue that needs to be addressed when it comes to being knee dominant and getting tight in the quads and causing pain into the knee is the backside, the other side of your hip, the glutes, making sure they're activating properly and they're activating daily, and when you're going about your movements, that you're putting pressure through the knee evenly versus anteriorly. So for example, when I have people that come in to see me for knee pain and they say, I feel it when I'm walking downstairs. Right there I can see that it's tightness in the quads causing maltracking, but that movement in general tends to be a very knee dominant movement where a lot of the pressure is going anteriorly into the knee. What you want to practice in your day-to-day tasks is, if you're very knee dominant, tend to be on your toes using your quads a lot, is to adopt more of an approach to movement that involves being centered on your foot, using your hips versus just the knees when you're squatting and moving about. So you're sitting back, you're more center through the knee versus anterior through the knee.